Healthcare goes before gas. It goes before everything. If you don't have health, you don't have anything. You have nothing.
Most Americans know more about the car that they're buying than the health care that they're getting.
And I don't think a national health insurance program should pay for care that's unproven. So when you have health insurance, you just don't get everything. You get everything that's proven cost effective.
Doctors don't take the time to listen. They come in, how are you, da-da-da, out.
Being a student, I would have to work a full-time job to get benefits, to do anything, because as a student, I can't afford any health care whatsoever.
Do I change jobs and take an inferior job that pays less to get better insurance? Those are horrible decisions to have to make because they have such impact on my future and my family's future.
If I insure my car, it's insured for damages. If I am insured for health care, I don't know that I'm going to get covered until after I have the problem.
And I just do not think that anybody should be forced to sit back and go, gee, should I really go to the doctor today? Can I afford to go to the doctor today? I mean, I'm a full-time employed individual in this country, and I ask myself that question.
I've heard a lot of people in my family who've had great doctors that couldn't keep them once their insurance was changed by their employer. You build a relationship with a physician, and many times that relationship is not replaceable.
Nobody's really responsible. It's like insurance companies and politicians are actually running the hospitals, not doctors and the people who are supposed to be giving care.
Everything's so expensive until it's like you have insurance, but then at the same time you don't have insurance because there's still a lot of out-of-pocket expenses they're wanting you to pay for that you don't have the money to pay for.
You've been paying out of your pocket all this time, and when you finally need them to pay, you're there fighting. And again, remember, you're sick. You're in the hospital. These people you're going through chemo. I was on chemo fighting my insurance company.
I got to spend $10,000 before anything helps. You know, that's just, it's hard to think about. You know, it's like not having insurance.
Reality is we can't afford not to go to universal health care because we've got so many people slipping through the fences, showing up in emergency rooms, not being properly diagnosed, and dying as a result. I mean, the bottom line is these people need care, and we need to provide it for everyone.
We have the best health care available in this country. The problem that we have is it isn't available to everyone.
Everybody is entitled to the same access to health insurance. Because you work for a huge corporation should not mean you have the benefit of getting better health insurance than someone who works for a small company of 3 employees.
As a small business owner, not being able to offer health insurance limits my capability to hire the people that I want to hire.
I'm really impressed and amazed with how many diagnostic tools there are and where science has gone, but I find that on the administrative side of things, it's astounding to me what little technology is used.
I wasn't on my mother's insurance anymore, and that's when I first applied for state insurance. And because I was not enrolled in college, I was not HIV positive, I was not pregnant, and I was employed, I did not qualify for health insurance.
We've been just stupid. I think we know better, but we choose not to do it. That's stupidity.
Stop listening to lobbyists who do not have any other interests but their own self-interest. And listen to me requesting that you look after us.
We actually have to develop a politically sophisticated, broad-based campaign that mobilizes American patients and the families of patients to make this thing happen. It's not enough to be right. We have to win this on a political field.
We always, as a nation, seem to be able to come up with the money to go kill some people. And maybe we could consider coming up with the money to take care of our people, and that would be a much more effective form of national defense.
And if we don't reform, if we don't change, we're probably looking forward to that 46 or 47 million uninsured going to what? 75 million? 100 million? I think our leaders need to think about who's going to pay for that.
The responsibility for the lack of affordable health care in America has to fall directly on us as citizens because we are not making our voices heard.
And I just think it's a question of, you know, not giving up and
storming out.
If we're going to fix healthcare in this country,
shift our attitude.
Work as a collaborative effort.
Start listening to us.
Reward quality.
What do I need?
Universal health.
Portable.
Simplified.
It's not outrageously priced.
I don't want to have to think twice about bringing my kids in.
The bottom line is
we need government to step in.
Let the private sector do it. Personal accountability.
guaranteed access to health care.
Find a way
to take care of each other.
Focus.
So we need to do something now.
Before the government says we'll have to do it for you.
Equal for everyone.
For everyone.
Excellent.
It has to be done.
Make it run properly.
Step up to the plate.
Work it out.
Let's get it done.
It's time.
We can all be healthy.
God bless us all. Hope we can figure it out before it's too late.